Hey y'all, I decided to do my final paper over chronic obstructive pulmonary disease, also known as COPD. COPD is a progressive and irreversible inflammatory lung disease that is characterized by chronic airflow limitation due to airway abnormalities. This includes chronic bronchitis, emphysema, and what happens is the inflammation causes structural changes in your airways, which narrow your airways, cause you to overproduce mucus and reduces the elasticity of your lungs, therefore reducing the recoil, which leads to air trapping and hyperventilation. Now, there are several predisposing factors, of course, the most significant of which is going to be smoking. Other factors include long-term exposure to irritants such as dust, fumes, and general air pollution. There's also a genetic factor which can be tested for. It is the alpha 1 antitrypsin deficiency. Now, other predisposing factors are recurrent respiratory issues, aging, because our lung function naturally declines with age, and lower socioeconomic statuses, because those people tend to not go and see the doctor, even though it's linked to increased exposure. Less access to care always complicates things. Now, some testing that you can have done: chest x-rays, CT scans. You can test ABGs. Like I said, you can also test for that alpha 1 antitrypsin level, which is the genetic factor, and sputum cultures. Now, clinical manifestations of COPD are going to be a chronic, incessant cough, copious sputum productions, problems breathing, especially with any exertions, wheezing, cyanosis, barrel chestedness, fatigue when they breathe in the tripod position or use a lot of pursed lip breathing. Potential complications are going to be, of course, your acute exacerbations, respiratory failure as a whole, pulmonary hypertension, right-sided heart failure, pneumonia, and then depression, anxiety, and then malnutrition and weight loss. Generally, just to manage the disease, in the ICU, we're going to use the ABCDEF bundle. There's generally some COPD action plans. The first and foremost thing, if they are still smoking and they've already been diagnosed with COPD, we have to do smoking cessation education and encourage